One common condition has been linked to chronic fatigue, thyroid issues, digestive problems, skin conditions, joint pain, and many other diseases. Clinical nutritionist Courtney Little will tell you how to identify and defeat this common enemy known as leaky gut syndrome. Courtney will join me shortly. I'm Bob Garvin. Welcome to Body Talk, episode 94. People are expendable. Just use them and then kick them to the curb. Does it sound cruel? Well, it's exactly what's happening to millions of people in the United States every day. These smart, able-bodied people are shunned and left to feel like they have little or nothing to contribute to society. When they apply for jobs, they're usually not invited to interview, and if they are, they're quickly shown the door. So who are these unwanted masses? They're people over the age of 50 who are left out and ostracized because they're aging. Ageism has never made sense to me. Maybe it's because I was raised by my grandmother who rescued me from an abusive stepfather who used to beat on me just for his own perverted enjoyment. I always admired my grandmother's knowledge, strength, and wisdom that can only come with aging. Why then do companies and hiring managers treat older people like yesterday's trash? Is it because they're afraid to look at their own mortality in the faces of these older people? Or do they mistakenly believe that you can't teach older people new tricks? When I was 17 years old, I asked my 89-year-old great-grandmother what she attributed to her long, healthy life. Work, she told me. Stay active, she said, and keep on working. To young hiring managers, I say, if ageism is going to end, it has to begin with you. If you don't do it, then you're dooming yourself to the same age discrimination that you practice today. Questions or comments? Send an email to lifestarmedia@gmail.com or message me on Facebook at Body Talk Bob Garvin. Clinical nutritionist Courtney Little joins me now to talk about the massive bodily destruction caused by leaky gut syndrome and what you can do to identify it and fight it. Courtney is the owner of Nutrition and Whole Health Solutions in Bedford, Massachusetts. Courtney, welcome to Body Talk.
Thank you, Bob, and thank you, listeners.
Today we're going to talk about something that I must admit I don't know a lot about, so I'm going to be learning this along with a lot of our listeners, and that's leaky gut.
Leaky gut has become more and more of a popular term heard today because it's linked to so many different symptoms and diseases. So today we're going to be talking about, so what is a leaky gut? How do I know if I have one, and how can I heal from this? So let's get started. Let's dive in. So Hippocrates once said that all disease begins in the gut, and we are seeing this more and more to be true. Many people today are suffering from something called leaky gut syndrome, which you may or may have not heard of, but maybe don't know exactly what it is. So kind of the technical term is increased intestinal permeability. This leaky gut sounds like it just affects your gut, but in reality, it can affect your whole body and make you more susceptible to an array of health conditions and diseases. So here are some signs that you may be suffering from a leaky gut. Chronic fatigue, weight gain, thyroid issues, anxiety, digestive issues like irritable bowel syndrome, Crohn's colitis, skin conditions like eczema or psoriasis, joint pain, depression, headaches, and autoimmune disease.
Wow, this is a total body malady.
Yes, exactly, which is why it's so important, because a lot of these, symptoms or diseases that I just named off, there's no cure. Oh, you have chronic fatigue, you just have to, be really good with drinking your water and sleeping. Well, that's not a great diagnosis to have, and to know that you can never heal from it and there's no cure. More and more over the past 10, 20 years, people have been starting to look back into the gut and seeing its connection to the whole body and to disease. So what exactly is leaky gut? It kind of sounds weird. It's a kind of a weird term. Picture the lining of your stomach like a net with all these little tiny holes. These small holes only allow very specific nutrients to pass through. This is normal and what we want. The gut lining, or the net, works as a barrier and as protection. It also helps to keep out bigger substances that can damage our system, like certain proteins, undigested food metabolites, and bad bacteria. When someone has a leaky gut, the holes become damaged and they grow in size. Now this allows toxic waste to leak through the inside of the intestinal wall into the bloodstream. Once this happens, it's going to signal our immune system to go into overdrive because the body thinks that there's a threat and will produce inflammation. Okay, this is so key and so important. So now this becomes intestinal inflammation of the gut lining and makes us more susceptible to a variety of symptoms and health issues that I previously described, including autoimmune disease. Well, 80+% of our immune system is in our gut. Autoimmune disease, thyroid disease, Graves', Hashimoto's, colitis, diabetes, osteoporosis starts in the gut. And so many people, 1 in 5 people today, have autoimmune disease. So what causes our gut lining to be damaged over time? This doesn't just happen. These little holes don't become just bigger holes over one day or two. It's a series of buildup and occurrences that happen over months or years. So what makes these small holes into bigger holes? Chronic stress, toxins, a poor diet, pathogens in the body. So what are pathogens? In simple terms, they're bad bugs. A virus that could be kind of dormant and lurking in your body. Bacteria like H. pylori and other different bacterial infections, which a lot of people have undiagnosed, which can really disrupt the net or the lining, the stomach lining, okay? Parasites, candida or yeast overgrowth. These are the different pathogens that can really start to wreak havoc on that lining. Organ dysfunction. So I mentioned chronic stress. Well, when you are chronically stressed out, your adrenal glands, which secrete adrenaline and cortisol, which are your stress hormones, become tired over time. And when your adrenal glands become tired, your body doesn't start to produce the proper amount of digestive enzymes and hydrochloric acid to even break down food properly, which can cause a cascade of events and disrupt this flora in our gut. Certain drugs and medications can affect the lining of the stomach. And dysbiosis. So what's dysbiosis? Well, in our body, and in particular our gut, we want symbiosis. That's the healthy balance of good bacteria to bad bacteria. Dysbiosis is when the bad bugs are bigger than the good bugs. That can really make those holes, those tiny holes, a lot bigger, and now we have toxic fluid seeping into places that it shouldn't, which is signaling that autoimmune response. And in our other episodes, we've talked about, okay, when our immune system is on overdrive repeatedly, our metabolism goes on the back burner because it's not the priority. The body and the immune system thinks that it needs to fight or flight, there's a threat, and so all that energy is going to go to immunity, which is one of the reasons why people are tired when they have a leaky gut, because the reserves aren't being used properly for each body system. So how do we fix this? First, we need to remove the stressors. We have to take out the top inflammatory foods, such as processed foods, sugar, gluten, and processed dairy. Okay, these are the top inflammatory foods and some of the most common hidden food allergies today. So by eliminating these foods out of the diet, there will be a cooling effect, and it will help lower inflammation so the body can start to heal itself.
How long does something like that take, though, before somebody might notice a difference?
I have people within days that can start to feel better, but just because they're feeling better on the outside, they're probably going to be healing for 2 to 3 years on the inside. In order to get a damaged gut, like I said, it doesn't happen overnight, and you're not going to heal overnight. But you can definitely symptomatically feel so much better on the outside, but just know your stomach on the inside has some healing to do. But there's ways to do it, and we're diving in on how to heal this. Also, decreasing stress. I don't care what exercises, food you're eating, supplements you're on. If you're chronically stressed out, it's going to slow down your healing. So removing the negative people or situations from your life, or learning how to manage and deal with it and change your viewpoint on it. Getting adequate sleep, yoga, journaling, meditation, whatever you need to do to lower your stress and make your health more of a priority. I hear people say all day long, I don't have time. Of course you don't. You're telling the universe, you're telling yourself that you don't have time. You won't have time. You have to start making your health and your healing a priority. And if it's important, you'll find a way.
And you have to make the time.
You got to make
clearly.
the time, right?
People that work out with me, the ones that are most successful in staying with their workouts are usually the early morning ones that make an appointment with themselves before the day interferes with their personal life.
Yes.
And they get it done all the time.
Yes, exactly. People ask me, I see up to 26 clients a day. And every Monday morning I come in with my bag of my food, and then I do a little bit more on Wednesday. So my batch cooking days are Sundays and Wednesdays. How am I supposed to eat properly if I have back-to-back clients all day long? You have to be prepared. I'm clearly busy too, but it's important to me, and I'm not going to tell someone in front of me to do something if I'm not going to be doing it. So decreasing your stress. Also, you want to find out and remove any infections in the gut, and that's why I'm obsessed with something that we do in the office called NRT, Nutrition Response Testing. It's one way to analyze the body and pick up on hidden things that blood work is not picking up on. So those are parasites, candida, viruses, bacteria overgrowth. And it's great. To heal a leaky gut, you have to eat well. There are definite supplements that are going to be game changers. But if you have a chronic infection in your stomach, that does need to be handled. That's a big part of healing from a leaky gut. Second is repair with healing foods and proper supplementation, definitely probiotics. So diet is key in healing a leaky gut, like I said. The key is lots of naturally unprocessed foods that don't have genetically modified organisms in it, lots of fermented foods with healthy bacteria to help replenish the gut, healthy fats and proteins, and low inflammatory carbohydrates such as fruit and vegetables. So sweet potatoes, beets, butternut squash, and fruit, those are some of the best carbohydrates that you can be eating to help heal your gut. And then also too, bone broth, we've talked about in different episodes, but bone broth has so many key nutrients that help to heal and seal up a leaky gut, as does collagen protein. We love Vital Proteins. It's a name brand of protein powder, and it's 100% collagen. It's incredible. And that really is very healing for the gut. So people use it as protein powder, but there's so many other health benefits. Not just on the outside for great hair and skin. That's all wonderful, but a healthy gut is a healthy body. And coconut oil. Coconut oil has caprylic acid and lauric acid, which helps to fight infections in the gut. And it's really great for lowering the inflammation so the body can start to get ahead and heal. So some of the supplements that I love to help heal a leaky gut are L-glutamine, digestive enzymes, and oil of oregano. And you always want to make sure that you're getting organic and pharmaceutical grade vitamins and supplements, because A, you don't want to be wasting your money, and B, you don't want to be utilizing supplements or vitamins that aren't really the vitamin. So if it's organic and or USP grade, you know that if it says L-glutamine, it is L-glutamine, not different fillers and chemicals.
The organic oil, you take that in a capsule? Or?
The oil of oregano can come as an essential oil, or sometimes it's put into a capsule. And oregano oil should only be used for a short period of time. It actually helps to fight bacterial, yeast infections, and parasites in the gut.
It seems as though a lot of times the leaky gut comes down with other things, like it takes the hit for so many other external things that are going wrong with the body. And what I wonder is, listening to you talking about it, does it start with the leaky gut, or does it it starts there?
That was the biggest point I wanted to make, in ending this episode today, is it's not like, okay, I have a hypothyroid and then I have a leaky gut. No, you had a leaky gut first, then you got a hypothyroid. It is the root.
One question about the probiotics. There's so many of them on the market, and there's so many different strains that are out there now. And some of both they have 6, 8, 10, 12 strains. Should we be really concerned with that, or do we need to be looking for any specific
I know I sound like a broken record. The reason why I do NRT, or nutrition response testing, in my office is because every individual is so unique, so I test to see what the body needs. As a general rule, Whole Foods and natural food stores always have really nice probiotics in the refrigerator section. You always want to make sure that you're getting your probiotic in the refrigerator. And I wouldn't start off with a mega dose. I would start off just kind of like a medium dose and talk to the person that's there in the whole body section, and they'll kind of point out which ones. And I always like doing a prebiotic and probiotic together because that helps hold the good bugs in and set the stage for the good bugs thriving in your body.
When you take a probiotic, is it important to take it with a meal, before or after?
Just get it in.
Right,
so
okay.
just get it in. What's important is that you get it in. With or without food, just get it in.
Thanks so much,
You're
Courtney.
so welcome. Thank you, listeners.
Well, that's it for this edition of Body Talk. My producer is Katie Stell. The Body Talk theme song was composed by Rob Carlson and sung by Vicky Vox. If you'd like to stay up with medical studies on a daily basis, follow me on Twitter at BGPVideo. And if you have any questions or comments about this program, feel free to send me an email at lifestarmedia@gmail.com. Body Talk is a production of Lifestar Media.